am Shelby Sheppard. I am a nurse practitioner and the program lead for the hormone therapy program. I chose this path in healthcare because I was tired of hearing the same story over and over again of people feeling dismissed, their symptoms are normal, their blood work is normal when they feel like something's off. And I think in our traditional healthcare system, we really focus on treating numbers and not people. And I really wanted to develop a practice where I could spend time with people and focus on their health concerns. And that's where Hormone sort of came in, is that I recognize a lot of these people were experiencing symptoms of hormonal issues. So whether it was perimenopause, low testosterone, PCOS, and I felt like I could really dive deep into those symptoms and help them create a treatment plan where they felt empowered and could really take charge of their health. And that's why I have focused on hormones. I think for me, I define health and wellness through pillars of wellness. So movement, sleep, nutrition, mental wellness, and then hormones. And I think that they all work together. You can't sort of just isolate one because you will not get the impact on your overall health and longevity that you're looking for. And I think it really comes down to that sort of health span, lifespan, with health span being defined as the number of years you're living without chronic disease or disability and in generally good health. And science has made it so that we live longer, but we don't necessarily live healthier. And I think when you really hone in and prioritize those pillars of wellness, that's when your health span starts to equal your lifespan. Okay, I think it sounds very simple, but sleep. If you can prioritize your sleep, it can make a huge impact on your overall health and wellness. Because if you think about it, if you're anyone that's ever struggled with sleep issues, when you're not sleeping, everything else is harder. Like, you're gonna pick up takeout on the way home, you're probably not gonna go to the gym. Those stressors are just harder to deal with. And if you can really prioritize good quality deep sleep, it's like the one thing that can make a huge impact on your health. I really try to practice what I preach. I move my body daily, whether it's a walk with my dogs or getting into the gym, eating a nutritious, balanced, whole food diet. I try to keep my stressors as minimal as possible, and really sleep is so important to me. But I think if you're starting a health and wellness journey, really focusing more on consistency rather than perfection, because at the end of the day, if you start putting in the work and showing up for yourself and you see those results and how you feel better, that's going to make a huge impact on your overall health and wellness long term. I wanted to work in health and wellness to really focus on how can I make an impact and a difference for people. And really, I worked as a nurse and I saw sort of our really downstream broken healthcare model where we're not focusing on individuals and how do we prevent illness and disability long term. And I wanted to try to make a difference in individuals' lives where I could really listen to them and validate their concerns and help empower them to make the changes that they need. One myth about health and wellness I wish people understood. I think the idea that normal labs means you're healthy, I think that's my biggest myth, because my philosophy is normal isn't optimal. And just because your labs are normal doesn't mean that you're in good health and going to live necessarily a long, healthy life. And again, going back to the whole health span, lifespan piece. A non-negotiable for me would be getting some sort of exercise. I think that exercise is so important, not only for your physical health, but your mental health and well-being. And so for me, I know that I don't feel like myself if I don't move my body in some way. And like I said, that's either a walk with my dogs or getting a workout in at the gym, just something. It makes a huge impact, not only your physical health, but your mental health. I hope that people, when they work with me, feel heard and validated in whatever concern that they came to work with me on. I hope that they feel like they are a partner in their healthcare and that they really have a say in their overall health and longevity journey. And I just really want them to feel empowered at the end of the day to make informed choices about their healthcare. I loved SABI's approach to collaborative care that is also evidence-informed and innovative, and looking to have all practitioners under one roof is really important to me because we can collaborate better that way. But also I think looking at things in a different lens where it's more of that preventative, proactive approach that is open to new evidence and emerging trends and techniques and technology. I think that's what really drew me to SABI because I think that that's missing in our traditional healthcare model.